Ladies and gentlemen, thank you for joining us today. If you could begin to take your seats, we're going to begin in just a couple minutes. Once again, thank you for joining us today. If you could take your seats, we will begin shortly. Thank you. Once again, ladies and gentlemen, please take your seats. Our program is about to begin. Please take your seats. Our program is about to begin. Thank you. At this time, ladies and gentlemen, please welcome the Chancellor of the University of Illinois Chicago, Michael Amaritis.
Well, good morning, everyone. I'm Michael Amaritis. I'm the Chancellor of UIC, and it's a great pleasure this morning to welcome you to our university and to share this groundbreaking ceremony as a celebration of the future and as a sign of our strength and our momentum as a university and as a healthcare delivery system, even during these unprecedented times. I would like to recognize our distinguished members from the university community, starting with the University of Illinois board member and chair of the board's Health Affairs Committee, Dr. Stuart King, a graduate of our medical school. University of Illinois board member, Trustee Ramon Cepeda, Ray, who is also a graduate of UIC, of our College of Business. University of Illinois board member, the UIC student trustee, my most recent boss, now Jocelyn Bravo, a future graduate of the UIC. We have our University of Illinois system president, Dr. Timothy Kalin, and Tim is here, and I keep reminding him he may leave at Urbana, but part of his appointment, he's a faculty member here at UIC. And the University of Illinois Foundation board member, Don Belinsky. I saw Don. Where are you, Don? He's there. He is on the foundation board, also a graduate of UIC from the College of Business. It's also a great pleasure to see our elected official with us today, as we are joined by Illinois Senate President, Senator Don Harmon, right here in front of me, 39th District. Do I have this right? And then Illinois State Senator Omar Aquino, who is the Senate co-chair of the Latino Caucus, 2nd District. Do I have this right? And then we also have a very good friend of the University, Illinois State Rep, Teresa Ma from the 2nd District, who is just bordering us right here. And I think that we are also expecting Lakeisha Collins, who is running, she's right there, who is running unopposed in November after she won the Democratic primary to represent the 9th District, and this is going to be your district starting in November, so welcome. We're delighted to have you here. What I would like to say is that your support to all of you who are elected officials, and I need to add also Alderman Walter Barnett from the 27th Ward. We are in his ward right now, and those of you who are in Chicago know that the alderman is the most important person that we can have and the one that can move things around here. So your support for UIC, your support for public higher education, and your support for our healthcare system is more critical than ever now as we face budget uncertainties and also the continuing mitigation of a pandemic that has dramatically changed our world and our daily lives. I want to thank you, and I'm delighted to have this opportunity to thank you for all that you do to help us continue to serve our students, our patients, and our communities here in Chicago and beyond Chicago. It's also a great pleasure today to welcome Bruno and Sally Pasquanelli, and also their daughter Betsy is with us, and to have this opportunity I think everybody knows what Bruno, Sally, and the entire family have done. But let me give you an opportunity to clap again when I tell you what they have done, really in more detail. To have this opportunity to extend our gratitude to them for helping us make today a reality with a very generous gift from their family foundation of $10 million to name the 3rd floor Outpatient Surgery Center. So thank you. The Pasquanellis have been devoted friends and supporters of our medical enterprise in many different ways and for a number of years, and they're very close to one of our distinguished medical leaders, Dr. Enrico Benedetti, who is our chair of surgery. Bruno is a kid that was born in this area, in the Cabrini Hospital, as he keeps reminding everybody, and I know that he and Sally are more excited than anyone else in this tent. And I want to make sure that both of you and the entire family are recognized on behalf of our patients, because our patients are going to be the true beneficiaries of your very generous philanthropy. So thank you one more time. Finally, I want to extend a warm welcome to 2 special advocates for the university. We have Dr. Jorge Cavero, a graduate of our College of Medicine, a donor and a strong advocate for the university. And we also have a non-UIC graduate, but she has been advocating, I can tell you this, I know firsthand, for this university for over 5 years now. My wife, Hiro, is here as well. Just a few weeks after I arrived at UIC in 2015, at a dinner that I had to be introduced to some of our most active physicians, I heard for the first time that a need existed for quite some time, actually, before 2015, for an outpatient surgery facility. And the evidence to support this is overwhelming, and you will hear more about it today in the program. I also heard that these physicians had put a significant amount of time and their own resources advocating for it, but they were not successful. I heard the same story the first time that I met Bruno, who was involved in this effort as well. I heard the same story from Dimitri Azar, who was at the time the dean of the medical school, and he's watching us online today because he wants to make sure that this is real and this is happening. And I heard the same story from the CEO of the hospital, Dr. Avijit Ghosh, who was the CEO of the hospital at that time, and now he has the opportunity to see this project through as the CFO of the entire University of Illinois system. I didn't promise them that UIC will build this facility because I couldn't. But what I did promise them is that we will find an innovative way, an innovative solution to have somebody else do it for us. It did take a little bit of time because in the process, we found out that we needed legislative relief, and Senate President Harmon was a co-sponsor of the bill that allowed us, opened the door for us to build this facility as a public-private partnership, and we much appreciate your advocacy and your support for this bill to go through. And I'm thrilled that today you are breaking ground, while at the same time, we are offering another example of how a successful P3 partnership, public-private partnership, can work. By the way, this is our second building in the last 2 years, and through this approach, we were able to continue building facilities for our students and for our patients at a lower cost and at much higher speed. Thank you for taking the time to join us here today and making this important advancement to our mission of healthcare delivery a priority. I'm looking forward to cutting the ribbon together in, let's say, less than 2 years from now, so we can put some pressure on time and under budget, which is our message. So thank you again for joining us, and it's my pleasure now to welcome to the podium the chair of the University of Illinois Board of Trustees Health Affairs Committee, Dr. Stuart King.
Take this off now. Thank you, Dr. Emeritus. I really appreciate that very much. It's an honor to be here today. I want to provide a very warm welcome for everybody and a very affectionate and warm welcome for the Pasquinellis and their gracious gift. Thank you so much. I'm honored to be able to stand here not only as a trustee, but also as a physician and a citizen of the state of Illinois. This healthcare enterprise and system is critical now more than ever to the citizens of our state. It's true both in terms of the vital health care that we provide, but also through the education that we provide for the next generation of physicians, nurses, and healthcare professionals across the entire spectrum. We have a dual mission of both education and providing for healthcare, and I know that's what stands behind the University of Illinois healthcare system. It drives them every day. The new outpatient surgery center and specialty clinics that we're going to break ground for next door, right here today. This is, I was going to say groundbreaking, that's probably metaphorical. It's going to be the new home for outpatient surgeries that are now performed in the main hospital. This new operating center will have 24 bays for anesthesia, 8 operating rooms, and it will be connected to the hospital by a bridge for rapid access to patients and healthcare. There will also be 3 outpatient clinics, ophthalmology, otolaryngology, and transplants that are now allocated and located in the eye and ear infirmary. Their move will free up space for future development. So those are the nuts and bolts of what we are doing here today. In human terms, all of this means that we can provide better care and training to those who are attending our university medical center. This project could not have come at a more crucial time. I think it's fair to say that we're living in challenging times one in which high-quality care is more important than it's ever been before, more of a necessity than at any other point in my lifetime. At this moment, the University of Illinois system and the University of Illinois at Chicago were built to meet this need. This is the core of what they do. The doctors and nurses of the future will be caring for patients trained right here. And I should flip that. The doctors and nurses that were trained right here will be caring for the patients. At the moment, this also comes with financial challenges. And I know that I'm not going to speak on behalf of the board, but I can say that we are very committed to the financial future of this university and to meeting the hurdles and challenges that are coming with this COVID crisis. There's no way to thank the board. I'd like to recognize Ray Cepeda over here, who's been instrumental in championing everything for University of Illinois at Chicago. And we've come to affectionately call him Dr. Ray on the committees. So thank you. It's not an accident that this project is among those that the trustees have seen as very urgent. It's an investment in a better future for Illinois and for the University of Illinois at Chicago. The students who benefit from this top-of-the-line facility will be the next generation of medical providers. They'll be the backbone of the physicianship, nursing, and educated healthcare providers for the state of Illinois. At any moment in time, not only here, but across our state, an alum of this university is performing life-saving medicine somewhere around the state, and that's without a doubt. So as a trustee, an alum with 3 degrees from the University of Illinois, I'm pleased and proud to support this endeavor. And I want to again thank the Pasquinellis for having the vision and understanding to make this committed gift. There are so many things that see us every day wanting our time, wanting our money, wanting everything. And you have seen the future, and you have invested not only in this university and its educational mission, but in the next generation of physicians that will serve the state of our state of Illinois very well. And I'm very grateful for that, and I appreciate it very much. So thank you. And thank you all for coming, and thanks for having me.
Thank you, Trustee King, for being here today, and thank you for your support of this important project. Thanks to all the other trustees as well, and the legislative leaders in the audience. Hello, I'm Tim Killeen. I'm the president of the University of Illinois system, and I can still remember how to tie a tie, although I haven't done it for several weeks, I can tell you. But like Trustee King, I'm ecstatic to be here today, to be part of the beginning of this long-planned project that represents a piece of the future for UI Health, for the College of Medicine, for the UI system itself, and for the people of Illinois and Chicago. Being here at this moment, I can't help but ponder on all the ways that UI Health has stepped forward in the last few months and continues to be called on and to respond to the needs of the city and the state in this difficult time. That's true of the entire University of Illinois system, of course, and as a team, my colleagues and our co-workers across the system have put their expertise, their skills, their ingenuity to work on the full range of challenges we face together in the coronavirus pandemic. So much remains to be done, but working as a team, we have accomplished a lot already. From the treatment right here of patients with COVID-19, to work in creating the life-saving vaccine that will be needed, to the remdesivir clinical trials, to generating data and information that help drive the decisions being made at the very highest levels of the state. What a team. The strength of this team is, of course, each individual member, and the strength of each member is the team. And that's a quote from Phil Jackson of the Chicago Bulls fame. Considered something of a master in assembling teams. But looking around, even right here, you can see many members of the team responsible for seeing this project, the UI Health Outpatient Surgery Center and Specialty Clinics building, through to today, the groundbreaking. In fact, so many people here today are part of the team that has enabled UI Health to take this long stride forward towards a future UI Health's substantial footprint in the medical landscape of both Chicago and the state as that grows. And I want to particularly thank Michael, Amaritas, Iro for their leadership, Bob Barish, his team, Mike Zen, Avijit, everybody who's kept with it, with this program, to see it all the way through to this exciting day, despite the obstacles and the cannons to the left and the right. And thank you so much, Senator Harmon, for your participation and leadership. Of course, Bruno and Sally, others will say this too, but we can't thank you enough for your generosity and your loyalty and your deep and abiding friendship. Thank you so much. Lives are going to be improved and saved here. Doctors and nurses will be trained here, and facilities pressure generated by the growing demand for the kind of care already offered by our medical professionals will be eased elsewhere within UI Health. This new center will be an important tool in helping the University of Illinois system fulfill its land-grant mission to serve the state of Illinois and its people to make their lives better, more prosperous, more healthy, and fuller of possibilities. And there's never been a moment, probably, when that responsibility, that calling, which is baked into our DNA, has been more important. And that responsibility makes us, our teammates, down to all the environmental specialists and everybody who works at UI Health, such an amazing team. And we have a number of them here today. We thank them for our help. You'll be hearing from some of our key lawmakers in a minute. And we also have many doctors and professionals in the audience. And I want to personally thank them for everything they've done in the last several months in particular, through thick and thin, through safeguarding resources, for dealing with families and circumstances of very significant difficulty, for their patience, their forbearance, for showing up, and for participating in generating the kind of health and vitality that we all need. So I honor those contributions deeply, and I think we all do. There's more to do, and the need goes on, and the need creates this opportunity that we are embracing right here to create a new legacy, an augmented legacy through this new facility, a legacy of care, a legacy of impact, of lives made better in the communities that surround this center. And it's that legacy we look forward towards with the really important symbolic step that we're all here to commemorate today, as he puts back on his mask. Again, thank you all of you for being here. It's such a thrill.
I think we were trying to avoid an MC, but as we do this for the first time under these conditions, I think I have to jump up and start introducing the speakers one after the other. So we're delighted to have the Senate President, Don Harmon, saying a few words next. And Bob, you're next.
Well, good morning or good afternoon, everyone. It is a pleasure to be here on campus and in the 27th Ward with my old friend Alderman Walter Burnett, and to be joined by Senator Omar Aquino, a key member of our Senate leadership team. Thanks for being here, Representative Ma, and our new representative. It's good to have so many new folks in the General Assembly. We are so lucky in the state of Illinois to have the University of Illinois system as the flagship not only of higher education, but also of healthcare. And while the Urbana-Champaign campus gets an awful lot of press, I have a particular soft spot for the UIC campus, not only because of the students you serve who live in my district, but also so many faculty and staff live in my district just a few miles west on the Eisenhower and the Blue Line. But also because I went to high school immediately adjacent to the campus and did a lot of growing up on the UIC campus some 40 years ago. It looks great now. Everything is terrific. I'm so thrilled with the investment in the community and grateful for your partnership. So thank you for the invitation to be here today, and more importantly, thank you for this project and for your continued investment in healthcare for the people of Illinois. This ongoing pandemic has reminded us in stark detail of the need to increase access to health care, especially in underserved communities. And that's what you're doing here, expanding access to the highest quality of health care in a time of need for the people in need, and you're doing it in an environmentally responsible way. You've got the right project in the right place at the right time. I look forward to the great things that will happen here. Thanks very much for including me. Appreciate it. Now I can go.
Thank you, Senator. Good afternoon, and welcome. I'm Dr. Bob Barish, the UIC Vice Chancellor for Health Affairs. So thank you, Chancellor Emeritus, Trustee King, Trustee Cepeda, President Colleen, for your continued support of this important project. Additionally, we thank all our legislators who've been here today, and again, Senate President Harmon for spending your day here with us as well. So as the state's public academic health enterprise, we have a distinct responsibility to translate the exceptional research and training of our university into outstanding patient care to better meet the needs of communities across Illinois and beyond. So this outpatient surgery center and specialty clinics will expand our capacity to develop upon this promise, allowing for even greater access for patients who turn to us for their health care needs. At UI Health, we remain committed to the pursuit of health equity, and this building project is among our strategic priorities to provide even greater access to our exceptional providers and clinical specialties. Now, what about this building? The sixth floor, 200,000 square foot facility will be home to outpatient surgeries, endoscopic procedures, and also providing services in ophthalmology, ENT or otolaryngology, transplant, urology, GI, diagnostic imaging, and we'll have our own site pharmacy right here. So the project's been many, many years in the making, and I think it's been about 20 years in the making, right, Chancellor? And through the efforts of so many involved and leaders here today watching us online, we're officially taking action to transform the landscape of our health enterprise. So although this building will capitalize on some of the hallmark services, it is certain to elevate our entire clinical portfolio and enhance the patient experience. So with just under 670,000 individual visits for nearly 152,000 patients in the past year, UI Health plays a critical role in providing life-changing care for our patients. So today, we celebrate not only the breaking of ground for this new facility, we also celebrate the incredible momentum of our healthcare enterprise. Despite the COVID-19 pandemic, we are continuing to pursue the additional projects of a new health welcoming atrium that'll open groundbreak in November, and of course our $120 million new electronic health record platform. So UI Health is truly charting a new future for our patients, our providers, and our entire healthcare community. So finally, I would like to extend my sincere gratitude to all our generous donors with us today, especially Bruno and Sally Pasquinelli. Now, you got to know something about Bruno. When I walked in here today, he says, Barish, you better make that thing look as good as the robotic surgery center, the world-class robotic surgery center that's going to open up 100 yards from here in 3 weeks. It's going to be the world's best simulation center, and I know, Enrico, you're very, very excited about it as well, but he said, you better make this a 22nd century facility, and we're going to do that for you, Bruno. So your generosity will support both the extraordinary care that we'll deliver in this facility and the wellness for our community. So thank you. And now I'd like to bring up the Dean of the College of Medicine, Mark Rosenblatt.
Thank you so much, Vice Chancellor Barish. Good afternoon. It is my absolute pleasure to be here today to celebrate this really auspicious occasion, especially considering the challenges that we have faced this year. A pandemic, a financial crisis, move towards social justice, and I'm very proud to say that UI Health, UIC, and our university has been at the forefront of facing each of these challenges. But the groundbreaking today provides us with a sense of hope and allows us to focus on what is the core foundation of our mission as a college, which is to advance health for everyone. And thank you so much to all of you who've helped to make this day possible and who've supported the efforts to make the Outpatient Surgery Center and clinics a reality. I can tell you this has special significance to me. Prior to becoming dean, I was actually head of the Department of Ophthalmology and Visual Sciences next door at the Illinois Eye and Ear Infirmary. And for 2 decades, I was told, we've been trying to create a new home for the infirmary, but also for our ORs. And all of the faculty told me it could never happen. I had a stack of 6 blueprints on my desk that had all been rejected over time. But something changed, and that something is the level of partnership that we've seen. Partnership with UI Health, the college, our hospital, but also partnership across UIC, partnership with our system, and of course our trustees. And this has been the catalyst for the change and the catalyst for this new project. We have other partners, of course, and I'd specifically like to thank Bruno and Sally Pasquinelli for your ongoing generosity to support UI Health, our college, and this new project. Without your help, this wouldn't have happened. And I know that underneath the mask, everyone has a smile as large as Mrs. Pasquinelli has on her mask, and you're really responsible for this, and we're really tremendously grateful. Now, this outpatient surgery center will help our communities. Right now, our operating rooms are beyond capacity, and it's really a need to expand what we can do for our community. We'll be able to create new ORs, those that are doing groundbreaking and innovative work such as minimally invasive robotic surgery. We'll also be able to have clinics that provide state-of-the-art, world-class environments to create health in our communities. And it'll create access. Patients who can't currently get access to our care will now be able to have a wonderful place for this to happen. All told, we expect more than 125,000 visits a year, both in our clinics and in our operating rooms, and this will be impactful. It will change the course of our community's health. I'd also like to thank those who've made this possible for allowing our faculty, in conjunction with faculty across UIC, to create a place where innovations will happen. New cures will be created in this new building. The next generation of great doctors, surgeons, and other healthcare professionals will happen and be created within this building as well. So, in closing, our community deserves this building, and we're really happy that it's finally going to happen. And I know that we're here proud to be a part of this important and monumental occasion. So with that, thanks again, and now I can actually introduce another partner, a different type of partner, Michael O'Keefe, who's Managing Director of Ancora.
Good afternoon. Again, I'm Mike O'Keefe, Managing Director of Ancora's Healthcare Real Estate Group, and am privileged to be serving as the project executive of our development team. When Ancora first heard UIH was planning this transformative project a few years ago, we knew we were the perfect fit to be their development partner. We just needed to convince them of that first. So we worked very hard to build a world-class, Chicago-based project delivery team. Ancora's team includes Shive Hattery, led by Tom Longy as architect of record, and ZGF as design architect and medical planners. Pepper Construction, one of the largest and oldest healthcare builders in Chicago, led by Rich Schuster and Dan Myers, in partnership with Brown Moman, is our construction manager. Target Group, led by Joe Williams, is our diversity, inclusion, and community outreach advisor. Mesero Financial and Cabrera Capital are our financial underwriters, led by Todd Waldrop and Martin Cabrera. JLL, or Jones Lang LaSalle, who is leveraging the largest healthcare facility platform in the world, will manage this facility when it opens. And Provident Resource Group, which is the non-for-profit ground lessee and conduit borrower, led by Steve Hicks, who has worked on other P3s with the University of Illinois and many other public institutions across the United States. The UIH Outpatient Surgery Center and Specialty Clinics is the first healthcare public-private partnership in the state of Illinois. The project exemplifies the best of what the private sector can bring: lowest cost, highest quality, innovation, speed to market, nimbleness, the ability to cut through the proverbial red tape. That combined with the highest tenets of the public sector, diversity, inclusion, and community outreach, competitive bidding, prevailing wages, and a sincere focus on designing a building that provides the safest and healthiest environment for providers and patients alike, especially for the post-COVID new normal we will be living in when the building opens in 2022. One that is highly accessible for the population it serves, one that is built to last, future-proofed and adaptable as technology advances and program needs change over time. A building that is sustainable and environmentally friendly, as evidenced by the fact that we will be LEED Gold certified. I have worked with some of the best and brightest healthcare leaders during my 30-year career, and I have to say, the caliber and dedication of the collective UIH, UIC, and U of I teams that have worked in concert towards a common goal has been really, really amazing. Starting with Michael Zen and his management team, in particular David Loffing and Bishan Nandi on the planning and operations side, and Larry Appel for finance. Senior physician leaders who have helped plan this facility, dedicated hours and hours. The U of I team, including Bruce Walden on real estate, Sarah Crane on finance, and John Alsterda for legal. UIC team members such as David Tayertz, who led UIC's design review committee for the project. The continual support we have received from Bill Bradford and Pam Hill of UIC's Capital Projects Group, and many countless others who have helped make this day a reality. It truly has been a public-private partnership. We look forward to making this project a reality and to UIH seeing its first patients in the fall of '22. See you all at the ribbon cutting. Thank you.
Good afternoon. My name is Mike Zen. I'm the Chief Executive Officer for the University of Illinois Hospital and Clinics. I will start by thanking everybody for being here, and I will end with that. This is certainly a wonderful occasion. I will first start by thanking our development partners. As Mike O'Keefe represented, they sit all behind me on the screen. They have worked behind the scenes in accomplishing much. Mike went through the project team internally that has worked on this. I do want to point out and pay special tribute to David Loffing, who has right from the beginning of this been the lead of the project, representing all of our interests, both College of Medicine and especially the hospital in this regard. I also want to note, my predecessor is here, Dr. Avijit Ghosh. We remembered that even though this goes back over 2 decades, that it was in a meeting in January of 2016 where actually the plan for this iteration of this building took shape, and now a little over 4 years later we're ready to break ground. So my thanks and acknowledgement to Dr. Ghosh for his participation and leadership in this regard. It is important that I add my thanks to Sally and Bruno Pasquinelli for their magnificent support. This is not just being financial benefactors. It was the encouragement and vision that Bruno, along with Dr. Enrico Benedetti, supplied that provided the emotional fuel to persevere the many hurdles to get to this day. And there were and continue to be hurdles to get this building built. It is also important to note how this new building will also serve as an important economic driver for the state and, more importantly, the communities we serve. Construction of the building, which is contracted to Pepper and Brown and Moman Construction, will employ approximately 500 individuals over the course of the 2-year project. As a part of addressing the economic health of our communities, and in concert with the university's minority and female business enterprise participation efforts, a minimum of 30% of the approximately $120 million will be awarded to BEP contractors. That's Business Enterprise for Minority, Women, and Persons with Disabilities. This is a significant undertaking to support not just the communities, but the economic health of the communities. Not just the medical health, but the economic health. In my very first meeting with Alderman Burnett, jobs in our communities was the issue we talked about for most of our discussion. This is our way of continuing the commitment for jobs in our communities. Operations of the new building and expanded clinical services will create an estimated more than 100 full-time positions. The majority of these new positions will be for positions that are a part of the university's collective bargaining units. That is also our commitment to the health of our communities and the health of our constituents. All of this gives us a better platform to address the community health needs. Continue our service as the market share leader in the core 26 zip codes that include communities throughout the west and south sides of Chicago. It is a significant tool in our drive to address the inequities of access, which are at the core of the disparities of health outcomes we are all well aware of. Now more than ever, this goal is an obvious societal mandate. It also provided added capacities to grow many of our clinical specialties, especially our surgical programs. As has been mentioned, an example of this is the moving of many of our outpatient procedures to the new building will in turn be able to expand our inpatient surgical programs in the main hospital. I want to thank the partnership with the College of Medicine as they have helped us design this building. I want to thank the leadership of the hospital, the health community, Drs. Barish, Vice Chancellor Barish, Chancellor Emeritus, President Killeen, and all of our governmental representatives and senators, representatives, and board members for making this happen and for us getting to the point where we actually start the building of the building in earnest. So as we bring this part of the ceremony to a close, thank you all for being here. Thank you for your support. We will make this happen. It will be a great thing for the communities we serve, and it extends our ability to be a vital part of what the state of Illinois and the University of Illinois brings to our citizens. So with that, I now invite our distinguished guests to follow me to the ceremonial ground right to my right for the groundbreaking of this building. So thank you all for being here. Thanks for your support.
Thank you.